I have to go see my patient.
Come in.
Hi, I'm Laura. I'm going to be your nurse today. I'm going to give us some privacy. I'm going to shut the door, okay?
Great, thanks.
I'm going to come over here and give a little hand hygiene. Okay, what's your name?
Lynette Leone.
Okay, I'm cross-checking that with your bracelet. And Lynette Leone, and what's your date of birth?
8/21/69.
Perfect. Do you have any allergies to any medication?
I do, to erythromycin.
Erythromycin, okay. That correlates with your record. Excellent. Okay, so I did hand hygiene. I checked you out. Okay, so my name is Laura. I'm a nurse, and what I'm going to do is I'm going to do a full head-to-toe body assessment. Okay. Is that okay?
Yeah, great.
Okay. Well, first things first, I'm going to get a set of vital signs, okay?
Okay.
Okay, so I'm going to, well, this bed is my working height, but I would raise the bed to my working height to make it easier for me. Okay. All right, so you've got your gown on here. I'm going to just push this up here into your skin. Okie dokie. And then we're going to get a blood pressure. Okay. All right, you can just rest your arm right there. Okay, I'm getting a blood pressure here. Okay, it looks like 120/80. That's perfect. Excellent. Get this out of the way. I'm going to get an SpO2. This monitors your blood saturation here. Okay. Ding, ding, ding. Oh, 98%. Excellent. I like that. Good. Okay, I'm going to check your pulse, and I'm going to check the rate, rhythm, and quality. And I'm checking for a minute here. Okay, it's regular, strong, and I checked it for a minute, and it looks like it's about 68. That's great. Okay, and while I was doing that, I was watching her inspiration or expiration, counting her respirations, and looks like they're about 13. So, okay. One more thing, I'm just going to check your temperature by your ear. Checking. Okay, 98.6, perfect. Okie dokie. Are you experiencing any pain today?
I am not experiencing any pain.
You're not experiencing any pain? Well, if you were experiencing any pain, maybe you should have like a 3 somewhere.
Okay, yeah, I'm having a left ankle pain, actually.
You're having left ankle pain. Okay.
Foot pain.
What happened? When did it happen?
Well, I sprained my foot about a month ago.
Okay. On a scale of 1 to 10, 10 being the worst pain you've ever had,
That's about a 2 or 3.
Okay. And what does it feel like?
It's kind of a throbbing pain.
Throbbing? Okay. Yeah, I get it. And is there anything I can do to make it feel better?
No, that's okay.
Does it radiate anywhere? Does it go anywhere else?
Just mostly in the foot and ankle area there.
Okay, all right. Okay, well now I've addressed your pain. I'm going to ask you a couple questions. And you know what your name is. It's Lynette. Okay, and do you know where you are?
I'm in my basement.
Okay.
In the hospital.
In the hospital. And do you know what time it is?
I think it's like 2:30.
And why are you here? Do you know how you got here?
I got here because I have pneumonia.
Okay, all right. Okay, so now we have your level of consciousness. You're not altered mental, but if you were altered mental or needed, I would make sure that you had your nurse call light so you could push the button here, which is, actually this is your call monitor right up here, so you could find it. Okay, so now I'm going to start from your head to toe, so I'm going to touch you. Is that okay?
Sure.
Okay, so I'm going to start with your head. I'm looking at your head, and I'm touching your hair, and I'm looking behind your head, making sure that there's no lesions, bumps, or anything abnormal. I'm going to look behind your ears, make sure they're normal, everything is okay. I'm looking in your ears, making sure that there's no fluid or anything draining out of them. I'm looking at your nares, they are perfect. You're perfect. Okay, can you smile for me? Perfect. Can you go like this? Perfect symmetry. Okay, so excellent. All right, so next I'm going to check your apical pulse, and by doing that, I have to, I'm also gonna check your neck and make sure that you're not swollen in any of your lymph nodes or anything like that as I work my way down, and that your skin is dry and intact and there's no lesions. Okay, so then I'm going to, this is your blue gown here, so I'm going to pull your covers down just a little bit, and I'm going to check your apical pulse, which is in 5th intercostal on the left hand side here. So I'm going to do this here, and I'm going to kind of wiggle my way over here, lifting your gown up. Okay. Okay, 1, 2, 3, 4, 5. Okay, because I'm going to listen for 1 minute. I'm going to listen for the rate, rhythm, and quality. It's strong, normal, and the rate matches your apical pulse, which was 68. Okay, excellent. And I'm looking at the skin. Looks like your skin is dry and intact. Okay, you can put that down. And I'm also going to compare your, radial pulses. Okay, so that matches your apical. And I'm going to have you squeeze my hands. Okay, nice. Both equal grip strength. Do you have any numbness or tingling or anything funny like that?
A little bit in my left hand.
A little bit in your left hand. Is that normal for you?
Yeah, I've had it for a couple of years.
Okay, sounds good. And now I'm going to check your cap refill. 1, 2, 3. Okay, perfect. Great cap refill. Okay, now I'm going to check your lung sounds. Okay. So we're going to expose your skin here. Okay, so I'm looking at your skin, making sure it's clean, dry, intact, no rashes or lesions. I'm going to listen to your lung sounds in an S-shaped pattern, and on inspiration and expiration. And then that one down there. Okay, great. I hear a little bit of wheezing, and it sounds a little rough in there, like Ronchi. So it makes sense that you're in here for pneumonia. Now I'm going to take a listen to your back. Okay. All right, I'm going to listen to a nice little S pattern on inspiration and expiration. Okay. Yep, on those lower lobes, it's got a little bit of, it's a little rough in there, and I can hear a little bit of wheezing. Okay. Because of that, we're going to give you a spirometer treatment. So we're going to have you do this machine 10 times an hour. And what it does is it helps open up your alveoli and get those small airways open. So this actually helps strengthen it and open them, especially when you're on your back. So what I'm going to have you do is you put this in your mouth, and you don't blow into it, you draw into it. So suck into it. Good job. And what you want to see is this smiley face. You want to see the yellow go into the smiley face, just like that. And we're going to do that 10 times an hour. Okay. All right, so we've done your lungs. I'm going to look at your arms now. Oops, sorry. Can I take that off again? Okay, great. So I'm looking at your arms, your skin on your elbows. I'm looking at your elbows. Everything is good. I noticed you don't have an IV yet or any PICC lines, but if you did, I would make sure that they're clean, dry, and intact. Okay, let's slip your gown back on so you don't get chilled. Okay, so then what I'm going to do next is I'm going to check out your abdomen here. Okay, so I'm going to look at your abdomen. I'm going to make sure that there's any rashes or lesions and the skin is clean, dry, and intact. And what I'm going to do is I'm going to listen to your bowel sounds. I'm going to listen to all 4 quadrants. I'm going to listen for 1 minute apiece. If I don't hear anything, I'll listen to 5 minutes apiece. Okay. 1, 2, 3, 4. vomiting, diarrhea, or constipation?
Nope.
Okay, I'm going to palpate the abdomen. I'm palpating the abdomen, looking for any tenderness, any rebound tenderness, any abnormalities, any distensions. Does anything hurt or feel funny?
Nope.
Nope. Okay. So, are you continent or incontinent with your bowel movements?
I can, yep, I can go by myself. I can hold it.
Okay. And when's the last time you had a bowel movement?
This morning.
Okay. And when is the last time you passed a gas?
About 20 minutes ago.
Okay. Well, all right. Good. That means things are working good. Okay. So now, since you're continent and we don't have to worry about any pads or anything like that. Okay. So when you go to the bathroom, do you need a urinal or a commode, or can you get to the bathroom on your own?
Nope, I can get to the bathroom on my own.
Okay, excellent. So we can put this down. The next thing I would be checking is the peri area, making sure it's clean, dry, and intact. And then I would ask, okay, so when is the last time you urinated?
About an hour ago.
Okay, did you have any hesitancy, urgency, pain, or burning?
Nope.
Nope, everything was good?
Yeah.
Okay. Are you continent or incontinent?
Nope, I'm continent.
You're continent.
Yeah.
Okay, so it's easy for you to go to the bathroom. And you don't have a Foley or any sort of catheter or anything like that, and so we don't need to worry about that. Okay, great. Okay, let's put that down. And then what I'm going to have to do is put your knee up. I'm going to go like this, and I'm going to check your backside bottom, okay? Your coccyx area. So just roll over. Okay. And I'm just looking to make sure that you're clean, dry, and intact on your coccyx area. Okay, that looks good. Okay. Next thing's next. I'm going to go to your lower extremities. Okay. All right. Let me check out your legs here. All right. So I'm comparing each leg. Making sure that they're symmetrical. I'm looking for any edema. Any edema or any swelling. Looks like everything is good. Okay. I'm checking to make sure that your pedal pulses, they're bilateral and equal. If I couldn't find them, I would get a Doppler, and I would make sure to double check that. Okay, I'm going to do a cap refill, and she's got toenail polish, so I'm going to do it right here. Cap refill there, cap refill there. Okay, I'm going to check. Oh, I popped your toe. Check between your toes. I'm going to check between your toes. All the skin is nice in there. Okay, good. I'm going to look at the bottom of your feet, and I'm going to look for any numbness or tingling. You can feel that, okay, right?
Yep.
Okay, I'm going to look at your heels. Look at the other heel. Okay, good comparison. So do you have any pain, numbness, or tingling in the lower half besides your left ankle?
No, it's pretty good.
Okay, and it's baseline that you're normal. You don't have any.
No.
Okay, excellent. Okay, so we got our cap refill, our pulses. We checked the lower extremities. Okay. All right, so I'm going to cover you back up. Okay, so when you're getting in and out of bed, when you're rolling around, can you do it by yourself?
Yep.
Okay. If you had to get out of bed, do you need somebody to help you, or can you do it by yourself?
I can do that by myself too.
Okay, so if you had to go to the bathroom, are you able to walk by yourself, or do you need help?
Nope, I can walk by myself.
Do you have a wheelchair, a cane, crutches, moped? Nothing?
I would like a moped.
Okay, good. All right, so it looks like your mobility is good.
Yeah.
Okay, so last thing I do is I'm going to check and review all your needs and make sure. So first of all, my name is Laura. If you need anything, let me know. Your call light is right here. I'm going to give this call light to you. So if you need me, you should be sure to hit the button. Okay. I've got your water pitcher right here, and I'm going to give you a little water. So whenever you're ready, you can have a sip. Okay. You're not a fall risk, but if you were a fall risk, I would make sure to get everything out of the way. And I'm going to lower the bed for safety position, and I'm going to put up your bed rails here, just this bed rail right here, for fall risks. Let's see here. So you got your water and your call light. Do you need anything else from me?
Nope, I think I'm good.
Okay, great. Okay, well, I'm gonna wash my hand, do my hand hygiene. Okay, alrighty. And okay, well, if you need anything, just you got your call light, and I will be right out at the nurse's station. Okay.
Thank you.
Mhm.